Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, I would like to introduce a powerful nasal spray that physicians frequently use for patients with allergy notes, also known as allergic rhinitis, Dymista. Dymista is a prescription combination spray containing two well-established allergy medications, Azelastine and Fluticasone Propionate. So it offers a dual mechanism approach targeting both rapid histamine-driven symptoms and the underlying inflammation from environmental allergies. You might recognize each ingredient in Dymista from products you can buy over the counter. Astepro contains Azelastine, while Flonase contains Fluticasone Propionate. Dymista itself, however, is prescription only, and the doses may not be identical to over-the-counter formulations. In Dymista, each spray delivers 137 micrograms of Azelastine and 15 micrograms of Fluticasone Propionate, whereas Astepro contains 205.5 micrograms of Azelastine per spray. The good news is that the generic version of Dymista has been available since 2020. So there are now multiple products with the same active ingredients and dosage. So what should you know about Dymista? In this episode, we will walk through 5 key things: its indication, how it works, how to use it correctly, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Dymista and who it's for? Dymista is a fixed-dose combination nasal spray that contains Azelastine, an antihistamine, and Fluticasone Propionate, a corticosteroid. It was initially approved by the FDA in May 2012 for the relief of seasonal allergic rhinitis symptoms in adults and adolescents 12 years and older, and this indication was extended in February 2015 to include children as young as 6. For many patients who have tried oral antihistamines or single-agent nasal sprays but do not feel adequately controlled, Dymista can be a strong alternative for this difficult-to-treat environmental allergy. Before starting Dymista, patients should discuss with their healthcare provider whether Dymista is appropriate and how it fits into the overall allergy management plan, including whether there's still a need for additional oral medications or other nasal sprays. Second, how does Dymista work? Dymista combines Azelastine and Fluticasone Propionate, which target different aspects of allergic rhinitis. Azelastine is an antihistamine, meaning it blocks histamine, the chemical that triggers itching, inflammation, and mucus production during allergic reactions. You may already be familiar with oral antihistamines such as Benadryl, Claritin, Zyrtec, Xyzal, or Allegra. In Dymista, Azelastine is delivered directly to the nose, where allergy symptoms begin, instead of being taken by mouth. On the other hand, Fluticasone Propionate is a corticosteroid with broad anti-inflammatory activity. It inhibits and suppresses multiple immune cells and mediators, helping to reduce inflammation and improve symptoms. By acting directly on the nasal mucosa, Fluticasone Propionate targets the ongoing inflammatory process that drives allergic rhinitis. Together in one spray, these two medications offer both rapid symptom relief and robust inflammation control, making Dymista particularly useful for patients with moderate to severe allergic rhinitis that are not fully controlled by single ingredient products available over the counter. Third, let's talk about how to take Dymista. Dymista is for use in the nose only. The recommended dose for patients 6 years and older is 1 spray in each nostril twice a day. Each spray delivers 137 micrograms of Azelastine and 50 micrograms of Fluticasone Propionate. Correct technique is important to ensure the medication reaches the nasal mucosa and to reduce side effects. For the first use, Dymista must be primed by releasing 6 sprays or until a fine mist appears. If the spray has not been used for 14 or more days, it should be reprimed with 1 spray or until a fine mist appears. Detailed step-by-step instructions are provided in the Instruction for Use section of the package insert and on the official website. But there are several key points. Before each dose, gently blow the nose to clear the nostrils. And always shake the bottle gently because Dymista is a suspension and needs to be well mixed. Keep the head slightly tilted forward, not backward, to minimize the amount of medicine that goes into the throat. If some medication does reach the throat and cause a bitter taste, that is normal but can be unpleasant. Avoid spraying directly on the nasal septum, the central wall between the 2 nostrils, which has abundant blood vessels and less nasal tissue. Spraying directly on the septum may increase the risk of nosebleeds without improving symptoms. After initial priming, each Dymista bottle provides 120 meter sprays. The bottle should be discarded after 120 sprays, even if medicine remains, because accurate dosing can no longer be guaranteed. Finally, avoid using Dymista together with strong CYP3A4 inhibitors, such as certain antifungal drugs or HIV medications, because they can increase systemic exposure to Fluticasone Propionate. Review all medications and supplements with a healthcare provider to screen for potential interactions. Fourth, let's review the warnings and precautions for Dymista. Even though Dymista is designed to act locally in the nose, it still contains both an antihistamine and a corticosteroid, so systemic antihistamine or steroid effects may occur. First, Dymista may cause drowsiness, mainly from the Azelastine component. In clinical trials, some patients reported feeling sleepy. In general, you should not drive, operate machinery, or do anything that requires you to be alert until you know how Dymista affects you. Alcohol and other medicines that impact the central nervous system may further reduce alertness and impair performance, so combining them with Dymista should be avoided. Second, local nasal effects may occur. This can include crossing in the nose, nosebleeds, runny nose, nasal ulcers, or rarely, nasal septal perforation, a hole in the cartilage between the nostrils. In clinical trials with Dymista, no cases of nasal ulceration or septal perforation were observed, but these potential risks are known with intranasal corticosteroids. Because steroids can slow wound healing, patients who have had recent nasal ulcers, nasal surgery, or nasal trauma should avoid using Dymista until healing has occurred. Localized fungal infections with Candida in the nose and throat have been reported with fluticasone nasal products. Tell your healthcare provider if you notice redness or white patches in the nose or mouth. If thrush or other Candida infection develops, your doctor may treat it with antifungal therapy and consider stopping Dymista. Anyone using Dymista for several months or longer should have the nasal mucosa examined periodically for changes. Third, because Dymista contains a corticosteroid, it can affect how the immune system handles infection and may increase infection risk. While using Dymista, patients should avoid contact with people who have contagious illnesses such as chickenpox or measles. The prescribing information specifically highlights tuberculosis, chickenpox and shingles, measles, untreated local or systemic fungal or bacterial infections, systemic viral or parasitic infections, and ocular herpes as conditions where Dymista may worsen the infections. If you have or had any of these conditions or have relevant travel or exposure history, Dymista should be used with caution and discussed with your doctor. Fourth, when nasal steroids are used at higher than indicated doses or in susceptible individuals even at usual doses, systemic corticosteroid effects such as hypercorticism and adrenal suppression may occur. Using Dymista together with other inhaled corticosteroids may further increase the risk. If signs of excess steroid or possible adrenal suppression develop, Dymista should be discontinued gradually, following principles similar to tapering oral corticosteroids. If you're switching from another steroid regimen, such as systemic corticosteroids, to Dymista, the transition needs to be managed carefully. Rapidly tapering or stopping a higher dose of steroid and moving to Dymista may cause symptoms of steroid withdrawal or adrenal suppression, or allow previously stabilized conditions like asthma to flare. Your doctor may choose to taper the prior steroid gradually and monitor for symptoms while introducing Dymista. Nasal and inhaled corticosteroids may also contribute to the development or worsening of glaucoma and cataracts. Any patient who notice a change in vision or who has a history of elevated intraocular pressure, glaucoma, or cataracts should have regular eye exams while using Dymista and promptly report visual symptoms to an eye care professional. Lastly, as with other corticosteroids, Dymista may slow growth in pediatric patients. Children and adolescents using Dymista should have their growth checked routinely while on treatment. And finally, let's talk about the side effects and safety of Dymista. In clinical trials involving patients 12 years and older, the most common side effects included altered taste, headache, and nosebleed. With the exception of altered taste, rates of these events were generally comparable to the individual components and to placebo. In the pediatric trial involving children 6 to 11 years of age, altered taste and nosebleeds were also the most commonly reported side effects. In long-term safety studies, up to 12 months for adults and adolescents, and 3 months for children 6 to 11, additional adverse events were reported. Importantly, all nosebleeds were mild to moderate and occurred at low rates. And Dymista discontinuation due to side effects was uncommon, around 2 to 3%. Post-marketing experience for Dymista, as well as for Azelastine only and Fluticasone only products, has included further reports of adverse events that are listed in the prescribing information. However, these events are reported voluntarily from a population of uncertain size, so it is difficult to estimate how often they occur or establish a causal relationship to drug exposure. In real-world practice, the key message is that patients should contact their healthcare provider if they notice any new or worsening symptoms after starting Dymista, so they can be evaluated and managed appropriately. And there you have it, 5 essential things you need to know about Dymista. For patients with allergic rhinitis who continue to experience runny nose, itchy nose, stuffy nose, and sneezing, despite over-the-counter or single-agent therapy, Dymista offers a targeted, potent treatment option with effectiveness supported by multiple clinical trials, showing improvements in nasal symptoms and quality of life measures. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.